My channel. This is Trev from Trevessence, and today we're going to continue the education of the diabetic patient. For those of you who have been following me, you would have heard me talk about the predisposing factors to getting diabetes and also the signs and symptoms of diabetes. Today we are going to look at a very serious complication of diabetes, and that is neuropathy. Did you know that there are 4 different types of diabetic neuropathy? But for today's video, we are going to talk about peripheral neuropathy, and that is the neuropathy that affects the hands and fingers, the feet, and the toes. These complications can also lead to further injuries. Imagine a diabetic patient who frequently experiences numbness and pain in the hands, and that patient is caring for a baby. And suddenly, that person experiencing that shooting pain and numbness in the hands and lets go of the baby. Imagine a diabetic patient who walks outside without shoes. They could get injured and not even realize that they are injured because they cannot feel their feet. I had a patient one time who told me she went to Walmart with her niece, and as she was going to Walmart, her niece kept snickering, and she kept saying to her niece, "Why do you keep snickering like that?" When she walked into Walmart, the people in there were looking at her, and she couldn't figure why, until she walked past a mirror in the store and looked down and realized she had no shoes on. And that's what her niece and the other people were snickering about, because as a diabetic, she could not feel her feet. And also that goes to show that patients with diabetes need to pay special attention to their feet. Because if you get an injury and you do not feel it, that could lead to an infection, that could lead to gangrene, and you could end up losing a toe or even your foot. And even though peripheral neuropathy can be painful and debilitating even, you do not have to suffer, because the complications can be managed with the proper treatment. First, you must see your doctor. You must tell your doctor how you are feeling, what you are feeling, how long your symptoms last, and what helps you at home, so the doctor can modify your treatment accordingly. Remember, no 2 patients are the same, and your doctor is your best bet to beating